Hello everyone. Today I'll be presenting the project titled Advancing Healthcare Predictive Analysis of Diabetes for Enhanced Patient Outcomes. This project focuses on using machine learning techniques, specifically linear regression, to predict the likelihood of diabetes, a chronic condition affecting millions of people globally. So, to begin with, the goal of this project is to develop a linear regression model that can predict the likelihood of diabetes based on several medical features such as glucose level, blood pressure, BMI, and age. Our objective is to understand the relationships between these features and the risk of diabetes, providing accurate predictions to help with early diagnosis and preventive measures. By accurately predicting diabetes risk, we can take a proactive approach to healthcare and significantly improve patient outcomes. In today's healthcare landscape, predictive analysis is becoming increasingly important, especially for managing chronic conditions like diabetes. Predictive models use historical data and statistical algorithms to foresee future outcomes. By leveraging these models, healthcare providers can identify high risk patients early and implement tailored interventions. This early detection can prevent severe complications associated with diabetes, such as heart disease, kidney failure, or blindness. So let's take a moment to understand diabetes. It's a chronic disease where the body either doesn't produce enough insulin or can't use it effectively, leading to high sugar levels. The impact of diabetes is substantial, but early detection through predictive analysis can significantly improve the management strategies. Predictive analytics helps us utilize the past medical records and clinical data to estimate the likelihood of diabetes in individuals. By identifying key risk factors like high glucose levels or high BMI, we can help healthcare professionals focus on preventive strategies. The goal is to use data to move from reactive healthcare, treating diabetes after diagnosis, to proactive healthcare, where we predict and prevent diabetes before symptoms escalate. So, for this, we have used the linear regression approach. We started by collecting the data set which contains medical features such as glucose level, blood pressure, BMI, and age, along with the target variable indicating whether the individual is diabetic or not. After loading the data, we pre process it by handling missing values, scaling features, and splitting the data into training and testing sets, usually an 80-20 split. We then apply linear regression, which models the relationship between these features and the target outcome. Next, we train the model on the training data using the least squares method, which minimizes the difference between the predicted values and the actual outcomes. Once the model is trained, we can use it to predict whether new individuals are likely to have diabetes or not. Finally, we evaluate the model using metrics like mean squared error and accuracy to measure how well the model generalizes to new data. So here's a snippet of the model training. First, we load the data set using pandas, and then we separate the input features from the target variable. After splitting the data into training and testing sets, we initialize the train the linear regression model. Once trained, we evaluate the model using accuracy to see how well it performs on the test set. The training process is critical because this is where the model learns the relationship between features and outcomes. The higher the accuracy, the better the model will be at predicting diabetes risk for new patients. In this code snippet, we have demonstrated how to load a pre-trained model and use it to make predictions on new dataset. So here we have loaded the model which we have trained previously. We scale the input features using the same scaler that was used during the training, ensuring consistency between the training and prediction phases. The output of a predictive analysis is either a diabetic or non diabetic label based on the input features. The key takeaway here is that by automating the prediction of diabetes risk, healthcare providers can intervene early with tailored treatments and continuous monitoring, leading to better long term outcomes for patients. Incorporating predictive analytics into healthcare leads to enhanced patient outcomes. By predicting diabetes early, we can offer personalized treatment plans, prevent complications, and even suggest lifestyle changes. This proactive approach reduces the burden on both patients and the healthcare system. To conclude, the integration of predictive analysis into diabetes management is essential for advancing healthcare. As technology progresses, we can expect even more accurate and personalized predictive models that will improve patient outcomes and quality of life. Our project is a step towards that future, and we look forward to seeing how predictive models continue to evolve in healthcare. Thank you for your time.